My name is Dr. Neha Shaik. I work at Near of Mount Sinai as a full-time cornea faculty, as well as comprehensive faculty. So cataract is really the clouding of the lens or fogging of the lens, you can say. It's a natural lens that you're born with, and that gives you the clarity of the vision, that gives you that crisp vision that you're looking for. But over time, with aging, it can get cloudy and foggy. So that's the cataract. Um, no, unfortunately, because most of the reason why you have a cataract is from aging, 90% of the time. There are very few other reasons that can cause cataract quicker in a patient. For example, if they have some systemic conditions when they're young and baby, that's called a congenital cataract, or if they have, a use of eye drops that they have to do, such as steroids. Those are the times when you can prevent the cataract formation, but most of the time you can't. It's just an age-related process. So if you can imagine going to a Niagara Falls or some type of waterfalls, how foggy the vision looks like, when you're seeing into the world through the Niagara Falls, that's how the vision looks like. It's super foggy. You can see stuff, but it's not so clear. And also you will lose some contrast over time. So it's interesting you asked me that question. With huge technology improvement from 1970s to now 2021, actually, we don't really look for a maturity of the cataract that much as we look at the symptoms, So every patient has a different symptom based on the type of cataract they have and what their functionality is. So really the cataract surgery depends on this day and age upon the symptoms. So if you're very symptomatic from the cataracts, it's recommended to be removed. Obviously, the sooner the better. You don't want to wait when it's too hypermature. We can discuss that later, but hypermaturity means it's too big of a cataract, and that can cause more complications while you're removing it as well. So we don't want you to wait too long, but definitely in the earliest stages, it's better for you. With better technologies, much, much safer procedure these days. So when you wait too long for a cataract surgery, the cataract becomes almost like a hard rock. And as you can imagine, it can be very hard to make it into small pieces, as well as it can lead to corneal edema. It can lead to high pressures in the eye, and can actually sometimes, unfortunately, rarely can cause total loss of vision as well. So we would not recommend any patient to wait that long for it to be removed. Correct. So over time, when slowly the cataract is getting worse, it can develop this thing called hypermature ripe cataract, when the cataract is trying to liquefy within itself. And that liquid that forms within the cataract can create a huge pressure in the cataract. And that pressure can also increase your eye pressure. So that can damage your nerve and make you lose your vision completely. And number two, it can cause a lot of inflammation in the eye as well. And while we're trying to remove this cataract, it can be very tricky, as the cataract underneath that liquid is very hard rock type. So it'll be hard to break it into small pieces, and it can cause more issues and complications in the eye. So that's the ripe and hypermature cataract we're talking about. So cataract surgery this day and age is very simple and straightforward compared to back in those days when we have a different technique of removing the cataract. This day and age, we use phacoemulsification, which is basically an ultrasound energy. We use a teeny tiny pen-like instrument, which has an ultrasound energy at the tip. After we enter the eye, we use that small ultrasound energy to help us break the cataract into little tiny pieces. It's manageable to remove those little tiny pieces very safely and securely from your eye. And once we remove the pieces, then we can replace that lens with an artificial lens inside the eye. And there's so many artificial lenses available in the market right now. Based on the patient's goal, we can pick and choose which ones you want and get you the best vision. The latest technology this day and age is femtosecond laser assisted cataract surgery. Femtosecond laser means it's very, very ultra fast. So using a very fast laser technology, it can easily soften up your lens. Especially hard cataracts can easily get softened up faster and quicker using less ultrasound energy ultimately, as well as laser technology actually is very neat. It can actually calculate the angle you have. It can actually measure how much distance you have from the cornea to the cataract, what the thickness of the cataract is. So it does all these calculations on the go while you're getting this done. And based on the calculations, it can actually also do a relaxing incision on the cornea. So it can relax your astigmatism at the same time of cataract surgery. And it can also beautifully create a nice opening in the bag that's naturally holding your lens. That opening will be much more precise than a manual type of opening, which we call capsulotomy, making it easier for the surgeon to remove the softened up nucleus out of the eye. So overall, this process will be much more faster, sometimes even 10 seconds to 20 seconds, depending on patient's density of the cataract. And once the cataract is out, then we can do the second step, which is basically placing in an artificial lens. So that's the latest technology, helps you with the astigmatism, makes the process much more quicker and safer. And also it can increase the vision recovery faster over time. And there are certain candidates, certain patients we would recommend this laser for compared to the others. So both are equally good. It depends upon the patient's anatomy. It depends upon patient's density of the cataract. It also depends upon the astigmatism. If a patient has a small amount of astigmatism to a moderate amount of astigmatism, let me back up and explain what astigmatism is. Astigmatism is a naturally occurring irregularity of the cornea that can happen. And it's present in about 80 to 90% of the patients. If you imagine your eye's front of the eye being nice and round shape, in some patients, it can actually be a football shape. And that change in the shape is called astigmatism. What's neat about laser cataract surgery is when they did the research studies, it shows it can actually accurately decrease the astigmatism, relax the astigmatism, making the vision a little bit more sharper and crisper and clear. So in those circumstances, when I see a patient's prescription is showing me astigmatism, I would probably recommend the patient to go for the femtosecond route because you can do both at the same time, cataract surgery as well as astigmatism correction. If the patient has minimal or no astigmatism and a smaller routine type of cataract, they can very well do really good with standard cataract surgeries. And at New York Eye and Ear of Mount Sinai, we actually do both. We have the latest cataract surgery, femtosecond laser assisted one that we do, as well as standard for patients who will benefit from that. So it could be done in certain patients. It's not recommended because of multiple reasons. Sometimes you can have infections, which are always a risk with any type of surgery. The same goes with cataract surgery. So we definitely don't want that. We don't want to do that for that reason. Number two, every eye heals differently. So we would want the patient to have a better vision in one eye, heal better, and then move on to the other eye while the other eye is going through the recovery process. For those two reasons, routinely, we don't recommend doing on the same day unless the patient has dementia, let's say, or it's a very difficult patient, such as a baby who needs a quicker recovery to prevent amblyopia, which is loss of vision that can happen in these patients when they're very young and have cataracts. In those type of patient population, then yes, it can be done for that above mentioned reason, but otherwise routinely we don't recommend. It can be risky with infection and inflammation that can happen. So it's not really the cataract, but we can say it's like a debris that forms after the cataract surgery. So once we remove the cataract and place the artificial lens, there's a bag that's holding the lens. And sometimes the bag can catch up debris and a little bit of scar tissue behind the lens. So that's what majority of the patients talk about when they say they have a secondary cataract. But it does not grow back. It's just a tiny bit of debris, a scar tissue that starts to develop like a haze behind the lens. And that we can easily remove with just a laser again in the clinic. 5-second procedure, doesn't even involve any pain or discomfort, no anesthesia needed, except topical, and it's quickly done. And not many patients have that. Maybe about 50 to 60% of the time, you may notice that type of secondary haze formation after cataract surgery. So it depends, but if you do the laser assisted technology, it's usually very quick, within a couple of days. I would say first 1 to 2 days or 3 days. But sometimes with standard cataract surgery, it takes a little bit longer recovery with swelling and the corneal edema, and that can take anywhere between 1 week to 2 weeks. And let's say if the patient has a very big, hard cataract, like a hypermature cataract, in those patients, sometimes it can take even more longer to recover. So anywhere between 2 to 3 days to 2 weeks is what you're looking for. Excellent question. So we have been trying so hard from 1960s and 70s, from the first time we were trying to do this cataract surgery alone and trying to perfect the formulation, the technique, the lenses that we use in the eye to give the best outcome for the patient. So most of the time, we're able to achieve that target with the best technology that we have. At New York Eye and Ear, we also have something called intraoperative aberrometry. Now, intraoperative aberrometry is a special device that actually calculates and remeasures your actual lens that you need while at the time of the cataract surgery. So, you can get a little bit closer to the best target that you want, which is the 20/20 vision with this newest technology that's available, which we didn't have before a long time ago. So with all this cool technology gadgets, as well as new intraocular lenses we have in the market available right now, it is possible to get the best vision that is 20/20. Now, sometimes you may not be able to achieve that 20/20 vision because of multiple other reasons. For example, the health of your retina also matters, the back of the eye, which is like the engine of your eye. If you have any issues going on in the retina, like membrane or retinal detachment or any of the things going on, that can limit your final vision, as well as if you have some glaucoma issues that can limit your final vision as well. And dry eyes, these are the other things that can happen that may limit you from getting the best vision. But overall, if you have a perfect eye health system from the front to the back, and you're using the right technology and the right amount of lenses and the right calculation, we are able to achieve more and more 20/20 target this day and age. Yes. So 2021 actually was a very exciting year. We have so many lenses in the market right now from different leading brands, giving the best vision for far, intermediate, as well as close up. So we call it trifocal lens. It gives you three different lenses, three different distances. So kind of like having three different lenses in one, just like your eyeglasses, kind of the same system, but in a small, neat intraocular lens form. And a lot of patients are liking that. The only problem with those type of lenses is sometimes when patients are driving mostly at nighttime, they may notice those three ring systems that comes with the trifocal, which is actually the benefit. That's how you see better at three different distances. The same ring system can create a glare and halos at night. And that can be bothersome for some patients. So it really depends what the patient really wants and what they're able to compromise in terms of the side effects that you can have with those type of really fancy lenses. The other lenses that we have are pretty good as well, such as bifocal, in which you have really good vision far away, as well as computer distance. One of the newest lenses in that category is an Eye-Enhance from Technis. It's a really good lens, and a lot of patients enjoy that type of dual bifocal vision. The third type of lens, which is simple, straightforward, but gives you the best clarity as well, is a monofocal lens. Monofocal means the lens is simple, standard, covered by your insurance fully, but it only corrects for one distance, such as either fully distance or either fully near. And for seeing close up, patient will still need reading glasses. And some patients are fine with it and very happy with that because it gives you that best clarity of the vision, but unfortunately does not have that bifocality or trifocality that we talked about before. So I often talk to my patients in detail. We do a pre-op consultation in the room when they're first coming for cataract consultation. We discuss different lens options and we discuss what the patient goals are. Some patients want really good independence from the glasses and they're very active, they're going outside, hiking. They also want to read better at close up, then I would recommend something like trifocal. But if someone does not like the idea of even having slightest amount of glare halos and they're okay to read with the reading glasses, then we usually tilt and customize that treatment plan for that patient with a simple monofocal lens. So I think giving one best lens idea is very difficult because, as you know, every patient is individual and everyone's prescription is customized. Likewise, their intraocular lenses are also customized based on their goals and their eyes' health.